Hello, everyone. This is Dr. Richard Fleming, and today is Monday, December 7th, 2020. I want everyone to pay particularly close attention this week to what they hear from the FDA regarding the vaccines submitted for emergency use authorization for COVID-19 or SARS-CoV-2. During the many months that the discussions have gone on about people dying from SARS-CoV-2, the question has never been whether we can limit or lower or ameliorate the symptoms that people feel when they get sick. The question has always been, what do we need to be doing to keep people alive who become infected? For those of you who are familiar with vaccines, you know that a vaccine is not designed to prevent you from having an infection. Vaccines are used to try to get you ready and more rapidly respond to an infection when you get exposed, in this case, to COVID-19. Despite everything you think in this rush to vaccinate millions and millions of Americans and hundreds of millions of people, if not billions of people around the world, I was never under the impression that we were looking for a vaccine that merely made people feel better and have fewer symptoms. I thought the goal was to reduce infection and reduce deaths. Well, the vaccines won't reduce the infections. And if all we've paid for are vaccines that make us feel less terrible when we get the infection, we have totally missed the mark. And we are doing it with a technology that hasn't been thoroughly tested and allowing big pharma and the government to play Russian roulette with our lives and the lives of the people that we care about. Earlier in this pandemic, I wrote an article, included it in the BMJ, in response to FDA drug recalls epidemic. Weight loss pill raised as Holy Grail is withdrawn from U.S. market over cancer link. The importance of this article is to show that when the FDA says a drug is safe and effective, they very seldom do a thorough job of determining if it's safe and effective. And now they want to approve a vaccine that isn't going to help save people's lives. It's just going to make them feel fewer symptoms when they get sick. When I wrote this article at the beginning of 2020, Forbes magazine had released an article that showed that in 2018, the FDA approved a record number of new drugs, 59. That was up from the 46 that they approved in 2017. A total of 105 new drugs in 2 years. And yet, in that same time period, 234 drugs had to be recalled. More than twice as many drugs were recalled as approved. Drugs that had been approved by the FDA previously, and lo and behold, major problems. If this vaccine was going to save lives, or these vaccines were going to save lives, we would be arguing a completely different set of scenarios. But that's not what's being claimed. It's going to reduce the symptoms. That's how you get to increase the efficacy of these vaccines. You quit looking for it to save lives or stop transmission of disease, and you just start saying it'll make you feel better. Tylenol and Motrin will make many people feel better, and they're already FDA approved and didn't cost billions and stir up a frenzy in the world while doing so. The actual answers to COVID-19 come from what you've heard as therapeutics, the drugs we use to treat to prevent you from dying from SARS-CoV-2. Those drugs we now know exist. Combinations of drugs that stop the inflammation and blood clotting that's killing people with SARS-CoV-2. And every one of those drugs is already FDA approved. Now, according to the rules, according to the statutes for issuing emergency use authorization drugs like these vaccines, those can only be issued if there is no currently accepted treatment. And that is the reason I would argue that the FDA has ignored the information from physicians in the United States and around the world that have shown that they can successfully treat people with COVID-19. But you wouldn't want that information to be accepted if your bottom line goal was to approve a vaccine that's going to make people feel better. As with all things, it's important to follow the money. And the people with the money seem to be exercising a tremendous amount of control. And based upon the track record of the FDA, it looks like they are very willing to call a drug safe and effective and then later recall it. Let's everybody remember the swine flu vaccine, another emergency run by federal government to develop a vaccine for a virus that caused more harm than it did good. To date, I am tremendously underimpressed with the track record of the FDA. And absent real data that shows that this vaccine does more than reduce symptoms, I'm hard pressed to find a reason for any emergency use authorization for these vaccines, or in fact, any reason for the FDA to approve them. But as long as they can keep you frightened and afraid, they have you exactly where they want you. Meanwhile, physicians who are declaring that they have drug protocols that are working get accused of malpractice, and their medical licenses are threatened by the states in which they're caring for you. It seems to me that somebody has put Big Pharma and the government, particularly the FDA and Health and Human Services, ahead of the patients in this country. It's happening in other countries. The only question is, are we willing to stand up for the rights and the safety of the patients, or are we going to roll over and allow the system to take advantage of us and take advantage of our patients? Sodomy may no longer be illegal, but when the government does it to you, there's something wrong.